For our ethical presentation, we decided to discuss eugenics and the ethical concerns that surround the topic. Our group is composed of Liz, Keely, Stephanie, Sapna, and Jamie. The objectives of this will be to define eugenics, discuss arguments that support and oppose eugenics, discuss current trends, discuss what ethical theories are violated by eugenics, and discuss where we may be in the future. Eugenics is defined by Merriam-Webster as a science that deals with the improvement of hereditary qualities of a race or breed. In other words, a science that tries to improve the human race by controlling which people become parents. Its first known use was documented in 1883 and can be positive or negative. Positive eugenics is artificial insemination by Albert Einstein, selecting for desired traits such as intelligence at the time of insemination. Negative eugenics would be best characterized by the Nazis in World War II. This is the eugenics tree. It is the logo from the Second International Eugenics Conference in 1921, depicting eugenics as a tree which unites a variety of different fields. This YouTube video will show a brief synopsis of the history of eugenics.
Question: what if the human race decided to selectively breed itself? Here's where it gets crazy. We have, or at least groups of humans have made the attempt. This practice, known as eugenics, has a bad name nowadays, but that wasn't always the case. Sir Francis Galton, cousin of Charles Darwin, coined the term in the 1880s, taking inspiration from the Greek phrase, born well. Originally, Galton proposed using financial incentives to encourage marriages that he believed would breed smarter, healthier children. While the term may have come in the 19th century, the idea has been around since Plato, and ancient civilizations also practiced various forms of eugenics. Today, it's associated with atrocities, genocide, forced sterilization, and infanticide. But in the late 19th and early 20th century, eugenics enjoyed tremendous popular support. It was hailed as a solution for a higher quality population. Multiple U.S. states passed legislation in favor of forced sterilization, removing criminals, people with mental disorders, specific ethnic groups, and more from the reproductive pool. This nationwide movement had opponents, but they were powerless to stem the tide of support for eugenics. A poll from 1937 indicated that around 2/3 of the U.S. supported sterilization of mental defectives. Before World War II, proponents of the established U.S. eugenics movement began speaking with scientists in Europe, including Germany, about the purported benefits of this practice. The Rockefeller Institution assisted in the creation of German eugenics programs. Today, the idea of selectively breeding a human being seems appalling. It stinks of racism, murder, and cruelty. But could wide-scale eugenics programs continue in the modern age? If so, it's something they don't want you to know. Stay tuned to learn more about genetic.
Okay, so there have been arguments for and against eugenics throughout the years. Some of the major arguments for eugenics include the idea of racial hygiene and improving the human species. This is what genocide and mass sterilization programs hope to achieve through creating a master race, such as what Hitler wanted. There's also the idea that it would reduce government spending on preventable genetic diseases through decreased hospitalization and medication expenses. It is also thought that it would improve quality of life for future generations economically, socially, and medically. And throughout time, it has been generally agreed that increasing intelligence of population should be the major goal of eugenics. Mass sterilization, gender control, and policies such as the Chinese one-child rule were used to reduce global overpopulation and poverty associated with that. And licensing parents to have children may reduce the incidence of unwanted children and the associated abuse and poverty that goes with that. Some of the arguments for eugenics include the concerns of being forced into participating in eugenics, which may create legal ramifications for those who resist, arbitrary standards of perfection, and who exactly is determining what the perfect person is. History of genocide and mass sterilization in the name of eugenics has tainted the name of eugenics altogether, so people tend to think of it as a bad thing. Inequities may arise due to those participating in eugenics, such as educational and occupational opportunities. There would be a loss of individuality and a limit to biodiversity. And licensing parents to have children may negatively alter life plans if they are denied the right to have children, and this may also create a black market for children, which could lead to a lot more problems down the road.
So, the ethical principles that are violated by eugenics include autonomy, justice, beneficence, and veracity. So, one of the main arguments is that eugenics, in regards to genetic design, infringes upon a child's autonomy. Autonomy is a self-governing and the freedom to choose. In regards to genetic screening, parents may choose to abort a child with a genetic disease. It is possible that some genetic disease may be able to be treated. In regards to sterilization, it should not be forced. The patient should have the right to choose sterilization and take into account their ability to make decisions for themselves, especially in the case of minors or those that are impaired to make the decisions. In regards to genetic design, there is a concern that only the wealthy will be able to buy tools and opportunities to enhance their future children, creating a genetic overclass. While normally it would be thought that genetic design would be used to select commonly desired traits, parents would also have the option to use eugenics to select not commonly desired traits, which was the case in where Sharon Ditchnow and Candace McClough, a deaf couple, sought to have a deaf child by seeking out a male sperm donor with a family history of deafness. Also, there is concern that the free will of a child's ability to choose who they may want to be may be violated because the parents may have engineered their child to possess traits that would make them more successful in one area than another. While supporters of eugenics would argue that a child possessing certain traits would not lead them to make definitive choices about their life path, those against genetic design definitely argue that it would such traits would influence both the child's and parents' perceptions of what path a child may choose. For example, an average type couple may design their child to be a 7-foot tall, large-handed child in order to be a basketball player. Some also argue that genetic design may influence a child's confidence, as they are the products of their parents' creative will, and this may lead to great expectations and great letdowns when success is not achieved. On the contrary, liberal eugenicists would argue that not being able to practice genetic design infringes upon the parent's autonomy and right to choose the best for their child, and also that the said child would not exist unless the parents chose certain qualities. Eugenics also may fail in respect to justice. Justice is the right to fair treatment and right to privacy. While modern eugenics mainly exists in the form of screening for deadly genetic diseases, bioethicists argue that increasing intolerance for differences could lead us down a slippery slope. And so it is possible that disasters from our past, like the incidents in Hitler's Germany, could return to modern day. In regards to gender selection and advancements in technology such as ultrasounds, these technologies have enabled parents to find out the sex of their child while in utero. This is problematic because sex-selective abortions leads to discrimination of babies based on their gender. This is a problem in certain countries, and especially because female infants may be discriminated against. Countries where it is common for sex selection eugenics to occur include China, India, and South Korea. Despite government attempts to combat the problem by making it illegal to use ultrasounds to determine gender in these countries, sex selection abortions continue. It is predicted that there will be an excess of 10 to 20% males to females in the mentioned Asian countries. Another principle that is violated may be beneficence. Beneficence is the idea of doing what is good for the greatest benefit. In regards to forced sterilization and other negative eugenics, providers should not perform care that would cause harm or injury to their patients. Liberal eugenicists would argue that genetic design, parents should have a moral obligation to give their child the best qualities, and they would also argue that parents have a moral obligation to participate in genetic testing. Veracity is the principle of truth-telling. In regards to coerced sterilization, consent may be obtained deceitfully, and patients may not be well informed by their providers on the effects, both temporary and permanent, of their procedures. One of the most well-known cases of sterilization abuse in the U.S. is the case of the Ralph sisters in 1973. In this case, the mother of 12-year-old and 14-year-old of the Ralph sisters went to a state sterilization and a state sterilization center, and what she thought she was signing was a release for birth control for her daughters, but later it was revealed that they had underwent sterilization. The Southern Poverty Law Center of Alabama sued on behalf of this family, and it was found that the mother was illiterate and unwittingly approved the procedures. When a public press conference was held, many women, particularly of the African American, Native American, and lower socioeconomic status in the South and Southwest, came forward during this time. When this case reached federal court, it was estimated that about 100,000 to 150,000 females were improperly coerced into accepting sterilization. It is important that when practicing, providers make sure to practice their responsibility of informing their patients thoroughly and consider ethical guidelines while before performing a procedure.
So one of the most significant outcomes of eugenics in practice today has been the use of prenatal genetic counseling, which gives patients more control over the health of their future families by identifying potential health risks that they may pass on to their children. And this is usually done through various genetic testing and family history tracking. Now, of course, this could lead to the ethical issues and down a slippery slope of, are we testing for diseases or maybe traits? And then what about the selective abortions that happen as a result? And while this is important to look at for the patient who makes the decision, oftentimes the rights of the unborn fetus are overlooked. So here are some of the outcomes and possible issues that healthcare providers could face in this new world of eugenics, which has created careers for both genetic counselors and geneticists. So if a provider has information about a disease in one family member, should other family members who could be carriers also be informed? This would be considered breaking confidentiality, but does the risk for the potential to prevent further diseases outweigh the burden of the family knowing when they possibly don't want to? And we also have to look at the access for healthcare and for these types of services in poverty-stricken people or rural settings who don't have the same opportunities as people with more resources in urban centers. Our healthcare system has its considerations in eugenics as well. For example, does the cost of genetic testing prevent any medical cost in the future? And if so, who pays for this in our ever-changing healthcare system of Obamacare? With known genetic problems, insurance discrimination and social stigmas may also worsen and should be taken into consideration when talking about the future of eugenics in public health.
Education and ethics are some of the biggest points surrounding eugenics that will affect nursing practice in the future. As we all think about our own personal values and ethics regarding healthcare, it is easy to see how ethics can affect nursing practice by the year 2020. If an increase in negative eugenics is allowed to proceed, there could be an increase in abortions. This can lead to personal moral dilemmas for nurses as they will be providing care for these patients. Nurses will also be involved in the testing and screening for genetic conditions and also in the decision-making for these families. This can make nurses feel uncomfortable with the appropriateness of these tests, like if it's for a very severe genetic condition or something minor like sex or eye color. Also, it can make nurses uncomfortable at how this will affect family members involved. Science in healthcare is a constantly changing field, which can make it difficult for health providers to stay current and up to date with this new information. In the future, nurses in all areas will be involved with information about genetic testing and helping families make decisions about their results. Nurses will become involved in explanations of genetic risks, making family pedigrees, and genetic counseling if their education and training is applicable. But they will also be seeing changes in information and populations in which this information is useful for. Because of this demand of new education and training, recommendations have been made to include genetic content in entry-level nursing programs, NCLEX, and certification examinations. Research has found that these recommendations have not been successful. One factor that contributes to this is the age of the registered nurses has been increasing. Older nurses are less likely to have genetic information included in their education. Another factor is that there is a lack of faculty who have the education and training to teach this subject in educational settings or in continuing ed credits. According to a competency review task force from the National Human Genome Research Institute, expectations and requirements of registered nurses in nursing schools were evaluated and named. Some of these expectations include demonstrate ability to obtain a minimum of 3-generation family health history, develop a plan of care that incorporates genetic and genomic assessment intervention, and perform interventions and treatments appropriate to clients' genetic and genomic healthcare needs. In conclusion, like all other moral dilemmas, eugenics wouldn't be a moral dilemma if there were not both positive and negative arguments to be made. We want to leave you with this question. So now that you have seen the arguments for eugenics, which side do you fall on? And these are our references.